Hi, everyone. Thank you for coming to our now webinar on sexual violence and domestic violence during COVID-19. This is the fifth or sixth webinar in a series that we've started to connect now members from all over the country to convene and talk about our priority issue areas and how they are being impacted by the pandemic and how we can use this as an opportunity to advocate on the federal level and on the state level to take action. So thank you for coming from all over the country. You can go to MassNow's YouTube channel to see the recordings of previous webinars, and please share this with your networks afterwards as we continue to invest in new strategies around the country to work together to promote a feminist future now. So one of the first topics that came to mind when the pandemic started for this webinar series was around sexual violence and domestic violence, because we know we are stranded at home right now, and that's not a safe space for everyone. And so I know that there's questions amongst all of our members about what does support look like right now during the pandemic, and also how can we make policy changes so that we can have systematic change moving forward. And this is not a new issue, but this is a new world that we are living in. And so I am super, super, super grateful to our experts here with us today, Indira and Monika, for bringing their expertise on both the clinical experience and the policy experience. So just to give you a little bit of background, Indira has been with the DC Rape Crisis Center for the last 12 years, serving in different capacities and lending invaluable experience, including leadership roles in fundraising, operations, relationships, all that coalition building work that is central to this movement building work that we're doing. And Monika is a lifelong advocate and policy leader. Elected in 2013, she is the third African-American woman elected to the Wake County Public School System Board in its 40-year history, which is amazing. And the first African-American woman to serve as the board president of the National Alliance Ending Sexual Violence, the policy voice for 1,500 rape crisis centers across the country. And as the executive director of the North Carolina Coalition Against Sexual Assault, Monika leads the survivor-focused charge for the 75 rape crisis centers and hosts a host of first responders across the state. So thank you both for Zooming in with us tonight to share your expertise. I'm sure folks will have questions throughout the presentation, so feel free to put them in the chat box anytime, and we will get into the Q&A session soon too. So with that, I'll hand it over to Monika to share her screen, and I'll let you guys take it away. Thank you.
So thanks, Sasha. I'm not going to share my screen at the beginning. I'll let you go, Indira, and then I'll give the data points relevant to your presentation afterwards.
Great. Thank you, Monika, and thank you, Sasha. Good evening, everyone. It is so wonderful to be with you all. Thank you so much for the invitation. I feel like I'm coming home because I spent a great part of my life in Massachusetts. I went to school Massachusetts, Norton, Massachusetts, Wheaton College. So I feel like I'm coming home a little bit. So I'm very familiar with Massachusetts now. So thank you again for having me. So as you all know, it's so much going on the ground as it relates to how COVID is impacting survivors of sexual violence. And so I want to give you kind of a broad yet deep dive into what we are seeing on the ground, as well as as well as some strategies for supporting survivors, for dealing with kind of these intricate issues that are coming up. It's changing daily in terms of the emerging issues that we're seeing. So my plan is to give you a deep dive, and then towards the end to give you some general kind of, as I call them, pearls of wisdom as you all continue to advocate and be on the ground. So when we first had to do the shift, going from in-person mental health services to telehealth services to virtual services, that was a heavy lift for rape crisis centers across the country, because historically rape crisis centers, we don't do virtual services. Part of our philosophy, I'm sure as many of you know, is really embedded in the in-person therapeutic services. And so when we had to make that shift as a result of the public health crisis, it was a major challenge for a lot of survivors of sexual violence. And so what we saw with that is we had to do a lot of reassurances around the technology and explaining to them that things would still be confidential. We also had to create choice gates, right? Because some survivors chose not to go to the virtual platform, but instead wanted to take a pause in their therapeutic services until we got back in the office. And a lot of rape crisis centers saw that. I think what was also important is that people made the assumption that survivors of sexual violence had access to technology at home, that they had access to the internet at home, that they had confidentiality at home in terms of being able to take a hotline call, in terms of being able to do a therapeutic session for 45 minutes to an hour, right? That's the privilege that we saw in folks assuming that everyone would have access in terms of survivors for this virtual platform. And so what did it look like in real time when some survivors didn't have access and some did, right? Part of what that lift was advocating and getting emergency resources in order to provide survivors with the technology they needed in order to still be able to access their mental health services. I think the other kind of big lift around that is there was a lot of advocacy with the licensing boards in jurisdictions for therapists because there were tight restrictions. So for example, DC and Virginia loosened their restrictions for therapists in order to have them see clients across jurisdictions. Maryland, on the other hand, took a whole lot of time, but they finally came around. But that was because there was a lot of push on social media, there was a lot of calling, there was a lot of advocacy saying, hey, you know, we're missing a lot of survivors because, you know, you all aren't loosening your restrictions. That even got more complicated with college students from across the country, right, when the university shut down. So on that level, we saw a lot of advocacy as well as some missteps with the powers that be in terms of what this shift and what this lift would look like in real time. I think the other piece is, in general, we've seen a significant increase in hotline calls from survivors of sexual violence. We've also seen a significant increase in additional requests from current clients because they're needing more services now. And this is also in addition to the increase in requests from new clients, right? So the workload and the capacity has increased tremendously, where rape crisis centers have had to expand the hours of their therapists, have had to do therapy on the weekends because of the significant increase that we're seeing. In addition to some of the needs that are being presented from survivors, a lot of survivors are reaching out for financial support, right? And so we have to begin to look at survivors in terms of wraparound services. They're needing financial support for basic needs, rent and food and medicine. We're seeing this a lot, particularly from our college students, because when the schools shut down, some went home, but some were not able to go home. And so what does financial support look like for college students when technically there is no survivor fund per se? And so a lot of college students who are survivors, and even those who are not survivors, have reached out to rape crisis centers asking, are they giving money, you know, to survivors of sexual violence for basic needs. And so that's been a really big emerging need that has happened. I think we also have to think about the impact that COVID has had on the culturally specific populations, particularly survivors of sexual violence who sit at the margins. We already know that sexual violence in general disproportionately impacts survivors of color and our LGBTQI survivors. Adding the racial inequities and just the inequities in general that we're seeing from COVID-19 exacerbates that problem. And so again, really thinking about how are we supporting our most marginalized survivors of sexual violence during this COVID epidemic. What I mentioned earlier around making sure that survivors have access to technology, making sure that they have access to the internet. We saw that specifically in communities of color. And so that was something important that we had to really advocate for. I think we also have to be mindful that there's going to be long-term challenges as a result of COVID on survivors of sexual violence. We are expecting a surge. We are seeing a significant amount of clients right now, but we have to remember the clients we haven't even begun to touch yet. The clients who haven't reached out for support yet, right? We know home is not safe. And so expecting what that surge is going to look like, expecting what that capacity building around being able to respond to that surge is going to be critical, which also leads me to my next point around, as I like to call it, the healers have to be healed, right? The folks who are on the ground, the advocates, the frontline advocates at rape crisis centers who are serving survivors, it is so important that they are not only taking care of themselves, but that agencies, that rape crisis centers, that they are really making a point to see how this is impacting them as advocates. How are we asking our staff, how are you doing? What are you needing? How are you experiencing this? It is a lot to hold your own trauma. Most folks who come to sexual violence work, they come from a personal space or they identify as a survivor. So what does it mean to hold your own trauma while you're also trying to hold someone else's trauma, or while you're trying to lead a rape crisis center or lead a program, right? We are seeing with rape crisis staff that they are exhausted, they are overextended, that they are worried about this pandemic. They are worried about returning to the office. They are worried about engaging with clients, engaging with survivors on a face-to-face basis. And so those are real-time concerns. And so what does supporting your staff look like? What does creating what I like to call this culture of care, where you're being really intentional during this COVID period? Are you setting aside time weekly or bi-weekly to do staff self-care, to do one-on-one check-ins, in addition to your collective check-ins as a staff? Are you asking basic questions? And I'm a trained social worker, so I come from a social work perspective, among many other perspectives. A simple question of how are you doing? How is your heart doing, right? I am baffled by the number of rape crisis advocates I hear from who say that their supervisors haven't even really checked in with them. That it's been business as usual, but there hasn't been what I like to call the humanity in just saying, hey, I know you're working 14, 15-hour days, but let me just take a moment to see how you're doing. So, I'm really encouraging folks to really kind of create this culture of care. And that's going to be even more so important when thinking about the reopening. Now, each agency, each rape crisis center, of course, will have their own policies and procedures for going back to the office. But from a survivor perspective, it's important. There are so many little details to think about when going back to the office. I just completed as I'm calling it, the re-entry plan. And staff are anxiously awaiting for me to send it because we're going to talk about it in staff meeting but I'm going to strategically send it at a certain time so they aren't mulling over it over the weekend. But it took me a while to really put that together, because every single minute detail, and of course you can't think about everything, but you definitely have to think about a lot of things. And so one of the things, particularly from a survivor perspective, is what's showing up is that as restrictions are lifting, as stay-at-home orders are lifting, what we've also seen is that survivors are struggling around coping with this COVID. And because they're struggling around coping and managing their emotions, they are resulting to unhealthy coping mechanisms. And some of those unhealthy coping mechanisms are not practicing social distancing, because they're lonely. They live alone, and so they, want to spend time with their boyfriend or girlfriend, or they want to hang out with their friends. And so if you have a survivor who is struggling with managing their emotions, and issues of anxiety and loneliness and isolation are coming up, and they decide not to practice social distancing, and you reopen the office and they come in for therapy, and they, have not kind of done what we would hope they would do, that puts the therapist at risk. It puts a whole lot of other people at risk, and frankly, the agency at risk. And so how to manage, all of those kind of dynamics. And so what I encourage folks to do is, when you're thinking about your reopening plan, and particularly how staff and survivors will engage, it's really important to try to have a pulse as to what's happening with your clients, and still what I call have a hybrid model of reopening, versus still doing some telehealth, and perhaps having a soft launch open, right? So for example, those clients who are not practicing social distancing, because they're lonely and they need that human touch, then they're going to have to continue to do telehealth for a while, right? And not come in the office. And so that's a way to try to mitigate that. And so those are some of just the minute things. And therapists and rape crisis center counselors, they're concerned about that. Right? They're concerned about that. And so thinking about all those different variables will be, extremely critical. And when you're thinking about reopening, thinking about clients who may take public transportation, what is that risk going to do in terms of coming into the office? Are there other modes, again, which is why the hybrid model may be good for a while, in addition to having some of the kind of in-person services, just to see kind of how this stay-at-home order lift is really going to happen. What I would also say is, rape crisis center counselors and advocates, we are essential workers, as quiet as it's kept, right? That's also kind of been a big fight during this COVID pandemic, is not recognizing that mental health workers, rape crisis centers, we are on the front lines. We are essential workers, right? As I like to call it, we're dealing with the mind. We are dealing with the mental health. And so being able to advocate for yourself as that, for your agency, being able to position yourself as that, is really critical. And for some rape crisis centers, particularly ours, that became really critical, particularly in terms of getting funding, in terms of getting kind of COVID emergency relief funding. So, definitely we are essential workers. I kind of just want to, my last kind of point, and then I'll turn it over to Monika, because I know I've said a lot, is as we're continuing to move forward in this COVID pandemic and we're taking it day by day, I encourage folks to, one, take a breath, right? Because it is a lot going on. As I was sharing with Sasha and Monika, it's been a heavy couple weeks. It's always something going on, but it's been especially heavy. It gets exacerbated by what's happening with survivors of sexual violence. We're seeing a lot more suicidal tendencies as well. I know my agency, last week alone, I tease my clinical director, and I say, I talk to you more than I talk to my mother, because, you know, every time there's a clinical emergency, you know, it gets elevated to me because there's a protocol we have to follow, and survivors of sexual violence are experiencing more suicidal tendencies. And when that happens, then, you know, we have to do a commitment, but that gets exacerbated when you're doing everything virtually, right? So definitely take a breath and remember that the healers have to be healed. As much as we are pouring out during this COVID season, we also have to remember to pour back into us. We have to remember to put ourselves on our own to-do list, whatever that looks like for you. What is your self-care container in the midst of this COVID crisis? Whom or what do you go to in the midnight hour when you are feeling depleted, when you are feeling like you can't take one more thing? So building your tribe and continuing to nurture that is going to be critical. What I would also say is, and there's a saying that we follow at our agency, is that survivors of sexual violence are the GPS in which we take our direction from, right? And so we are very clear that survivors of sexual violence know what's best for them. And so we are listening to them. We are holding space for them. We are bearing witness for them, right? They are telling us what they are needing, right? As I was putting together our reopening plan, I make it a point to have what I call a fireside chat with survivors of sexual violence. And I've been doing it once a month during this pandemic. Normally I do it quarterly, but I've been doing it once a month. And it's an opportunity just for me to hear from them about what's going on and how things are going. Is there anything that they want more of in terms of the agency? But it's also a chance for me to hear kind of what their concerns are in general as it relates to coming back and kind of re-entry and all of that. And so I think for me, you know, it's really important to kind of hear the issues that are impacting them. And so as I was putting together that plan, I kept a lot of what they told me in mind, which has been really helpful. So, you know, being able to create space to get feedback from survivors and to hear from them, I think is really critical. The other thing I would say is this is a marathon and not a sprint, right? We're going to be dealing with this for a really, really long time. And it's important to, you know, as cliche as it sounds, take it day by day. And I'm also a big believer in, although this is a marathon, sometimes it has to be a relay. And you have to be able to pass the baton to someone else who can give you a break. And that has become really, really critical as well. As I mentioned earlier, creating a culture of care in your office is so critical. I am always checking in with my team and really trying to pay attention to what I am hearing, because I know if things are not okay in their home life, it's going to show up in the work life. So when we do our check-ins at staff meeting, you know, if staff are worried about going to the grocery store or getting toilet paper or just not having all these needs, that's going to be impactful. And so really kind of creating a culture of care to hear what's happening for we had staff meeting this week, and I opened up the space to say, I mean, just a simple question: how are y'all feeling coming back to the office? And, you know, the floodgates open, right? Because I have to keep telling them, you know, and reminding them that we're going to have our own plan. We aren't going to be following what, you know, the mayor is doing, but I also keep reminding them at some point we will go back in life. You know, at some point we will go back, right? But some staff haven't left the house since we've been teleworking, right? And that's a little bit concerning because I'm like, y'all need some fresh air, you know, sit out on the porch. You know, at some point we will be going back, but again, it's that fear. And then what I, you know, would also say is sexual violence is not a single issue. because we don't live single issue lives. And so we really need to begin to have conversations across movements about how sexual violence is showing up in other disciplines and how it intersects. So for example, we really need to have a conversation around sexual violence and reproductive health. We know that 32,000 women a year are sexually assaulted, get pregnant as a result of a rape and need to access abortion services. We aren't having that conversation. Abortion services have actually gone up in the midst of COVID. Folks are accessing abortion services primarily through the pill and ordering that online. And so we aren't having that conversation around the impact of reproductive health on survivors of sexual violence. So really beginning to have those kind of cross-movement conversations. What we have seen is I'm having more conversations with our housing advocates. I'm having more conversations with our DC Abortion Fund because it's impacting our clients, right? I'm having more conversation with the DC Diaper Bank, who gives away free feminine products and diapers because that's what our clients are needing, right? I'm building a survivor closet at the office because when survivors come, they may need toiletries or they may need this, and so those those things are really important. And then the last thing, and then I'll turn it over to Monika, is one of my favorite sayings I like to just remind people is that in the midst of all of this, it feels heavy, it feels hard, but I like to say that this is not hard work, this is heart work. And so the reason that I'm able to continue to get up day by day is because I am leading with my heart. And for me, there is no higher honor than being able to be in service to survivors of sexual violence. There is no better time to be on the front lines doing sexual violence work than right now. We have some of the best advocates in the country fighting for survivors. And we have our national president, Monika, who is leading the charge. And I think we are going to have to continue to fight for survivors. We're going to have to continue to center them in a way that is intersectional. We're going to have to continue to center them in a way where we aren't just focusing on the sexual trauma, but we're focusing on all the other things that intersects with that, and how if they don't have diapers for their child, if they're getting evicted from their apartment, that's going to impact their sexual trauma. So I'm going to leave it at that and turn it over to Monika.
Thank you very much, Indira. As Indira said, Monika Johnson Hostler, she, her, hers. I'm the director in North Carolina, so I'm physically in Raleigh, North Carolina, of the North Carolina Coalition Against Sexual Assault, but I'm also the president of the National Alliance to End Sexual Violence. So it's my great privilege to share with you a little bit of a dive across the data that we receive from all the rape crisis centers across the country. So just I'm going to share my screen, or attempt to. I always have to put the PowerPoint up first so you don't see all the other things on my screen. So give me a second to get to all the other things off my screen. Maybe not. Here we go. All right. Yes. Okay. Can you all see it yet? You can't?
No, but I hear some very intentional clicks.
Yes, it's telling me it's sharing it, huh. Okay, Sasha, you may have to share, or we don't have to share it, and I can send it to you if people want it.
I will happily share it.
Yeah, you can hear all my, that's the thing about the Mac, you can hear all the clicks. It's not like a flat surface, you can hear all the clicks.
It's opening.
Very bizarre. Okay, I'll get started. If it pops up, great. If not, oh, there you go. We'll be fine.
Great. I think it's...
All right, so you all are aware of what we're talking about today, so I'll just, you can go to the next slide, which tells you a little bit about the National Alliance to End Sexual Violence. As I said, we represent the 50 plus coalitions that exist in every state and U.S. territory, and there are 13, almost 1,400 rape crisis center. I happen to live in North Carolina, the 8th largest state in the country, but the 2nd largest state with the largest number of rape crisis centers. We have a rape crisis center that covers all 100 counties in North Carolina. Sadly to say, we have 600 of those programs who actually responded to the survey, and not all 100 in North Carolina did, or we'd have more than 600. But this was a significant number for us, which in our opinion really spoke to the grave need of emergency services that survivors are indicating they need during this time. And so much for us, you've heard Indira talk about, is sexual violence and violence in the home has not ended at all. And based on where you live really speaks to whether people are projecting that they've seen an increase or a flat point in their crisis calls. But what you can hear across the country is people saying that services have become, the way that survivors are presenting are far more unique and complicated in the ways that they need services provided. And we do believe that that's largely because our rape crisis centers do provide free and confidential therapeutic services. And so, as you've heard Indira say, so much of what's showing up for survivors of all forms of violence is previous trauma, the trauma of COVID, and then also just the thoughts of what's next. You know, as human beings, we at least understand the concept of time, even though what may seem like 15 minutes could be an hour. Right now, the concept of time is more abstract than it's ever been for everyone, which means for those of us who the way that we deal with our trauma is having some form of control over something, we're completely stripped of that. And we have to acknowledge that not only are we experiencing the trauma from violence and harm, but we're also experiencing a significant amount of trauma just not knowing what our next is. And so we've definitely, heard and talked to our local programs about the things that are showing up for survivors. And Sasha, you can go to the next slide and you can click them all open because I'm going to talk a little bit about the data that we've received from that survey. And so what we certainly know is the number of sexual assault survivors, 89%, as you heard Indira say, really talk about the need for emergency funding. And it's not a surprise when we talk about the ways that violence impact women. So I don't have to tell now, or folks who are here, is women are already paid less. I was on a webinar about the ERA before I was on here. And so we know all of the things that impact us as women, or those of us who identify as women, know that systemic issue still exists. There are a ton of barriers that still prohibit women from being major earners. And so we still know that that's real. And additionally, we also know that survivors' journeys, their life journeys, are often impacted by sexual violence. So we also, for us, think about what are survivor needs. And people who seek our services are often seeking services because they are free. And so when we talk about emergency needs, we have low-wage workers, we have people who may be professionals, such as contractors, who now are all finding themselves without pay. So I would say, in talking to the programs in my own state, this need for emergency funding has really spanned the economic gap in a way that they had not seen before. They were absolutely providing emergency funding, but it was primarily for people who were on the lower end of our socioeconomic ladder. And in this case, they've definitely seen a change and a shift in that, from professionals also saying, we need some basic needs met. And straight to Indira's point as well, we are there for sexual assault, but people know when they call our crisis line, whatever the need is today is the need that we're going to try to meet as service providers. And so we also know that survivors experience different forms of violence. One of the things that's been important to us is really making sure that we're also connecting parents who are survivors of forms of violence, whether it's domestic violence or sexual violence or childhood abuse, is that we're connecting them to parenting services as well, because all of our emotions are all over the place And so people who would have never needed a service, guess what? Nobody's going to childcare anymore. You're your child's teacher, facilitator, daycare worker, cook, sous chef, everything. You're providing all of those needs for everyone in your home. In addition to, we also know that we have survivors who are not safe at home and are sheltered in a place that's not safe for them, and they may still be experiencing forms of violence. And so when we look at this 40% of our centers who've experienced an increased demand in services, a lot of those services are also your services that are far more taxing, meaning they don't have jobs. So how are we helping them secure economic stability outside of the emergency funding that they're requesting? Because most of our agencies have options for emergency funding, but quite frankly, those have also dried up for those nonprofits. So April was Sexual Assault Awareness Month. We didn't have the fundraisers that we would generally hold. Donors are not giving as much. So even when we look at our food pantries or our domestic violence shelters, who often get donations for food, toiletries, and other supplies, all of that number of contributions have gone down, but services have actually gone up. And so as you can imagine, as a nonprofit trying to manage that 40% increase may seem lower than people would assume, but that's because they've also used everything that they had access to prior to COVID, and now they're actually experiencing the demand going up without access to resources and donors. So we're also strongly encouraging people who are supporters and who can and find themselves in a financial way that they can still give, is definitely to give to our direct service providers. And you heard me talk about many of those have canceled events, both including fundraising and other advocacy strategies that our programs are often used to providing to actually solicit donations, and definitely a two-way street of them receiving community support in addition to funding has really, really diminished for those agencies while they're still trying to meet the need of survivors. So we definitely see a lot of cross-pollination across nonprofits of really trying to fill in the gaps with other service providers in community to meet the needs of those survivors. We can go to the next slide. The thing that you can't actually see on here that I think is important to also point out as Sasha goes to our next slide is the need for survivors themselves. Those needs are real because, as again, you heard Indira mention, the way in which we come to this work, the vast number of folks who do domestic or sexual violence are survivors or witness the trauma growing up. And so the personal impact is happening, and we're also seeing an increase for directors and leaders, to Indira's point, asking how can we provide services to our staff. And so one would imagine that as a nonprofit who provides services, we all believe tremendously in services and therapeutic services, but I can tell you, no surprise to anybody on here, that we don't pay our people well. They're making very low wages, and not all of them have full healthy benefit packages. And so even access to therapeutic services for our staff is something that I think is important for us to lift up during this time. One of the things that we've been able to do in North Carolina, and we've had a couple of our colleagues across the country also put this in place, is we've been actually offering 2 levels of support services to our agencies. We have therapists who are doing for those of you who are licensed, whether it's clinical social workers or counselors, they're doing supervisory support groups, so peer sharing for supervisors on how to support themselves, but how to support their staff. And then the other thing that we've done is actually open up therapeutic services for our staff. We believe that they have to be healthy and whole to do the work of answering that crisis line 24 hours a day, 7 days a week, even in the midst of COVID, and remembering that they're in the privacy of their home taking a call. Now, any of us who've answered a crisis line, we're used to taking a call at 2 or 3 in the morning, but this is every day for them now. Oh, great. That's my mother, and because I'm on a MacBook, it's connected to my phone. She is also checking in as a part of my support group to make sure I'm doing well each day. But I will tell you that's something we've never offered and has been a tremendous received with such graciousness from our advocates to say thank you for considering us as we're holding space and providing these therapeutic services in our home with our entire families, and still preserving privacy and confidentiality for those survivors. And again, if you look at the vast number of our rape crisis centers and shelters across the country, they are primarily serving rural America, because again, they're free and confidential services. So when you're serving rural America, you're also, that privacy is even more important to protect, so that survivors know that while I may be calling you and you're providing virtual support services, everyone in your home isn't aware that I'm seeking these services. And so one of the things that we are also seeing is an increase in statewide hotlines, where survivors are hoping that they're calling outside of their community, because they recognize that agencies, while are providing a hybrid, especially, I think we heard more than half of those agencies who responded are still in office. So they're doing a hybrid of in office and answering virtually at home. So recognizing that we still see the need to preserve that service and confidentiality. When we talk about that confidentiality, we're talking about the purchase of technology, technology for crisis workers. So making sure they have cell phones, hotspots, so that when they're doing virtual therapy, that they actually have stable connections and that they have the resources they need as agencies who are providing those services. But a lot of our agencies across the country are also providing that technology to hospital accompaniment, so that if a survivor is getting a rape kit done, and in our hospitals across the country, you can't take anyone into the hospital during COVID. So that victim is going into the hospital alone. And so making sure that they have access to still have that confidential service person with them over the phone, and not leaving that to your hospital or law enforcement or doctor's office to provide that. And so we've really also seen an increase in providing technology to our other first responders, so that victims still are able to be in touch with their rape crisis centers and know that it's free and confidential. You've heard Indira talk about the need for food and other supplies, feminine products. Everything is needed at this time. And again, with those donations not coming in, then we have our rape crisis and shelter saying we need to be able to purchase those things, which is new. When you're an agency that has really primarily survived off of donors and folks who are making contributions to meet the needs of survivors, but now you're having to purchase those. So we've also, many of our agencies across this country are heavily federally funded. So I'm here to talk to you about policy. And that's my lead in to policy, is really working with funders to change some of the policies that really determine how we're actually using those federal dollars. So you cannot use federal dollars that fund our services to purchase gift cards. So, or go to Walmart because they're worried about embezzlement and malfeasance. So really talking to our funders about how do we provide these basic needs to survivors at this time, when our funding prohibits that and we're getting less personal contributions and donors into our agencies. And so this is our biggest effort currently, is asking the government, and we've asked for in both CARES Act, the HERO Act, the stimulus package, to really increase the sexual assault services program, which is our signature program that is the only federal services for sexual assault. We have been very fortunate that the Family Violence Prevention Service Act, that provides mirror funding for domestic violence, they were able to see an increase in funding in the CARES Act, which is extremely important because that money went directly to shelters to pay for hotel rooms, because many of our shelters were full. And I can tell you across the country, our sexual assault survivors have actually also been going into those domestic violence shelters when they need emergency housing. So we were able to at least get funding put in the last stimulus package for shelters, but not for sexual assault services. The other thing that sexual assault services program does is actually fund communities of color organizations and tribal organizations. So this funding doesn't just go to our what we consider mainstream rape crisis centers like Durham, like the DC Rape Crisis Centers, but it also goes to communities of color, organizations that provide services to immigrants only, and organizations that provide services to our tribal community. So this pot of funding really reaches across all agencies that would be providing services to sexual assault survivors at this time. And we have been diligently using the data that we just shared. We've had Hill briefings with Indira's colleagues who are talking about what they're seeing firsthand. We actually have another Hill briefing that we're hoping the House Oversight Committee will have coming up to really talk about the systemic causes of sexual violence, to really help members of Congress understand the systemic issues, the barriers to seeking services during COVID, post-COVID. We'll still see, to Indira's point, we're going to see this long term. So really making the case to our members of Congress the importance of this funding, but also the importance of really looking at the current structure of funding so that we're able to meet needs that we have generally not needed to use our federal funding for at this time, to ensure that we're meeting the needs across the board. I could go on all day, but I do want to allow people, especially when you have a small group, it's important to me that people get all the opportunities to ask questions. So if people have questions, we are happy to take those, or I could keep going on about policy. Because the thing that I will leave with you all on policy is, locally, please be advocating to your county commissioners who now are also getting billions of dollars in COVID relief stimulus funding, that this is a great way to be asking your local city and county officials, based on who's getting that funding for our services. This is a great place to be asking for that, since I'm explaining how we didn't receive that funding directly to sexual assault service funding or Victims of Crime Act funding right now. So using CARES Act across the board. We're also asking our higher education institutions who are receiving stimulus funding, that can they put that money into counseling services for their students. Although their students may not be on campus, we've definitely had reports from student health services and counseling services on college campuses that that's who the student had the rapport with, so they're still seeking those services while they're home and not on campus. And so again, when we're talking about policy implications, we're talking across the board of the many ways that a survivor's lives intersects multiple organizations and multiple public services. And so we're asking them to join us in providing those services and access to emergency funding for sexual assault survivors. And I'll pause now for any questions.
I love it. Thank you so much for that. I know my mind is buzzing with all the different work to be done. I want to respect the silent pause for folks to ask questions. You can unmute yourself or write it in the chat box. Yeah, I think that's a great rule of thumb to end on. For every state, we should be connecting to the rape crisis centers in our state to see how we can support them directly with funding. I'm sure they're all looking for different kinds of fundraising opportunities. Also, our states are receiving money from the federal government, and so make sure that is directed towards the rape crisis centers in your state. And then also call your senators, right?
Absolutely.
All calling our senators.
Please call our senators. That is where our federal funding is sitting and not having a lot of movement. So please call your senators. Email them, write them letters, let them hear your voices and expressing the importance of really providing services that are invaluable now, especially for people who are at home. And all of our services are now virtual across this country. And that was a heavy lift, but we're doing it. We're watching our folks do this across the country, and the support can go much further, given we know that this is going to be long-term, especially as we anticipate a second round of COVID, and what will that mean to people. And we know that when people have experienced trauma, our body holds that, and then we go through another cycle. So again, we're certainly asking people to support our advocacy efforts, both at the federal level and in your local states.
Oops, stop sharing my screen. Yeah, and I also want to, I think, double down on stressing that we are in this for the long run, right? This is, even though we are reopening, that is a false sense of success, because we know this is going to come back. We know that we're not really fully reopening. And even though this was a crisis before, I think the fact that it can be so easily invisible is really dangerous, because if it's out of sight, out of mind. And so make it visible, in your social media feeds, by reminding each other that this is happening, even if you're not seeing it in your home, because we know that with social distancing, fascism is on the rise, and by that we mean rape culture,
Right.
and so that is happening simultaneously. So we know more people are being impacted by this than ever before.
Yeah, and the rape culture thrives and grows in silence and secrecy, and with every one of us literally across this country being at home, that secrecy is even more paramount for us to figure out ways to make connections and connecting to people. Sometimes we might be the only lifeline to someone else, and even if they don't disclose it, and people say it very flippantly, but check on your friends.
Yeah.
You may be the lifeline they need just to take a breath and say hello. And the other piece that I would say around, rape culture prevailing, that's also true if we think about across the country, we're hearing large numbers of COVID outbreaks in nursing homes and facilities where people live. Those are also places we need to be concerned, because those individuals in nursing homes or in any facility where they can't have any outside visitors, then we also have to be concerned about the impact there. That's our children who may be in group homes or foster care, which are all of these things are already make people vulnerable to violence. We know statistically being in facilities and group living situations make people vulnerable to violence. And so now more than ever, it will live and thrive there if we're not speaking out and making sure people understand that we recognize that this is happening, whether we can see it or not. And definitely the data doesn't indicate the impact. We will not know the true impact that this COVID has had on violence in people's home until much later. Even the data that I shared with you, that only speaks to the people who have the supports or the ability to make a phone call. It doesn't speak to the people who are being isolated and all of their movements are being controlled in their homes right now.
Absolutely. One of the things that I've been asking myself, or I've been kind of pondering over the last few weeks, is what does survivorship look like under COVID now? What does advocacy look like under COVID now? What am I needing as an advocate and a leader under COVID now in order to really show up fully and authentically, kind of in this new era, so to speak? And it's really hard questions to answer because each day is different, right? Each day is different. Being able to, I love my home. I've spent a lot of time crafting my home, but it's been a lot to be here on a constant basis. And so, one thing I've, told my staff is, you have to have a routine, right? Like you have to, like for me, like I do a morning walk and I do an evening walk, and, I posted on social media the other day, everything doesn't have to be a Zoom meeting, right? Sometimes you just have to say no to a Zoom meeting, because I think because we're all so stuck in the house that folks are looking for connection, rightfully so. But as folks have said it, and I think, Sasha, you were talking about it when we first got on, folks are zoomed out, right? And so the bigger thing is, what do boundaries look like, right? What do boundaries look like as we're, kind of dealing with this, day to day? But I think to Monika's last point around the really long-term impacts on not just the mental health of survivors, but we also have to think about the mental health of advocates, the mental health of leaders, because staff are going through it. They are going through it, and our movement as a whole is going through it. And so we can't dismiss ourselves from the equation as well.
Yeah. This is certainly one time in our country where no one is exempt from experiencing this trauma together. And while the impact may vary on each of us, and quite frankly, may vary day to day, I may be having a good day today and tomorrow could feel very differently. And really, Indira and I both always talk about giving people grace and recognizing how you show up today is representative of what you're holding today, but it's not a representative of who you are. And we have to also give ourselves those grace of being able to bow out and create those boundaries for ourselves, which in most cases gives other people the liberty to say, oh, you know what, you're right. I do have the ability to say, no, I can't do this. And so, I'm sure we're preaching to the choir to people who are dedicated to advocating on behalf of women and our most marginalized folks in our country. But I also know that because that's who we are, we also don't give ourselves those space and time to say, I can't do it, or I need to take a break. And so I think Indira's heard me say this. We've coined what we are calling meatless time. MEATLESS. And so, of course, I have a vegan on my staff, and she's like, oh, we're having vegan day today. Or, I'm going to be vegan for 4 hours. So my non-vegan people say, I'm going to be vegan for 2 hours. But also humor is a form that many of us use for self-care as well. And so, sometimes we just need the lightness to really be able to get through to the next thing. And so absolutely, thank you all. And it's a pleasure to have you all join and listen to us. And I hope we've said something that you can take away. And I certainly hope that you take good care of yourselves, and also take a little time to consider providing some advocacy with your U.S. senators, and certainly your local elected officials as well on behalf of survivors. We greatly appreciate your time and energy.
Thank you all so much. Sorry, I have to jump off. I just sent a chat. Thank you all so much. It was such a pleasure being with you all.
Thank you. And thank you, Sasha, very much.
Thank you both. I know we're also moved by listening to both of your presentation and hearing about all the work happening on the ground. So seriously, sending you both so much love from around the country, and all the survivors and now activists around the country. Thank you. We're in this together. I'll be emailing everyone this recording so you could share it with everyone and the PowerPoint. But I'll give the rest of your night back.
Enjoy. Thank you so much, Sasha. Thanks, everyone.
Thank you.
Thanks, Sasha.